Hey, Dr. Connor Nakarado here with PhysioStrength Physical Therapy. What we're going to be taking a look at today is the joints of the low back. So we're going to be specifically looking at the lumbar spine. There are a lot of patients coming in who don't really know what these joints look like, what the ligaments are, what the discs are, what the where the nerves really are at or located. So let's take a look at that. So looking straight from the back here, you've got two joints on either side at every level of the spine. These are your facet joints. These little guys where each vertebrae meets. These allow for your spine to bend forward and backward, rotate side to side, things like that. So those are some pretty important joints in the back. These facet joints can become kind of locked up, right? You've got a big capsule that comes around that. So if we add that on, right, you can see at every level this thing is the joint capsule. Right, if those get tight, that's going to limit or not permit movement to one way or another. Right, you can have tightness on one side, you can have it on both sides. Really just depends. And then as we take a look at this, right, you've got a lot of ligaments that help support the back. Right, so we don't need to go through and name all those or anything, but you do have your disc here. Right, these are pretty important structures. You've probably heard of a disc bulge or disc herniation. Right, the disc is really there to provide height through the spine and allow the nerve to come through that hole right there where the mouse is at. So if let's remove some of those ligaments really quickly so you can just look at the space where the nerve should come out. Right, so as we zoom in there, right, this is where, that's probably the best view we can get you there. This space right here is where those nerves are going to come out. So if we add on the nervous system, you'll be able to see there's a lot going on. But as we look, right, you've got different nerves coming out at different levels. So here's some coming out here, and if we go all the way up the spine, you'll see that same pattern. They keep coming out of that same spot. So the discs are really there to help, allow space for those nerves to go. Let's turn on some more ligaments, right? You can see the spine is a very, very stable structure. You've got a lot of ligaments around it that help support it. You've got a lot of nerves. The nervous system is very complex, which is why a lot of people get low back pain. Oftentimes it doesn't really have to do with the joint or ligaments or things like that itself. A lot of times it's just the nervous system, but that's a whole other discussion. So I just wanted to kind of show you guys that, give you a brief overview of the anatomy of your low back. If you're looking for specific low back exercises, please feel free to follow us on Instagram at PhysioStrength or check out our website. We put a lot of stuff out through there as well. I do have a low back ebook. I will put links to that here in the video on YouTube, and you can go ahead and check that out as well. It's got some tips in there to help you with low back pain. Anything else, please feel free to reach out to me directly through the contact info on our website. Thanks.